Okay.
As parents, we are given the gift of life. It is our duty and our responsibility to nurture and care for that life to the best of our ability. There's nothing more important that when you become a parent than deciding what form of nutrition you're going to be giving your child. Much of that choice becomes with the decision to breastfeed your child. The most important times for feeding and deciding to feed for their nutritional aspect is the first few months of life. Physicians and research have proven that breastfeeding is in fact the most nutritional form of feeding. I chose to breastfeed both of my girls, Layla and Libby. It was a personal decision of mine, and I saw the benefits in both girls. With Layla, she was born with a bruise about this big on the top of her head, and it was literally the size of her head. And the best treatment for that was recommended to us by her physician was breastfeeding, because it has antibodies in the breast milk to help rid of that bruise and heal that bruise. Libby was born with jaundice, and aside from the billy bed, the most sufficient form of treatment for her was the breast milk, because the breast milk there too has the antibodies to help heal the liver and rid of the bilirubin in her blood. Many people feel that formula is just as nutritional and beneficial for an infant as breastfeeding. However, after I present to you the research that I have done on the benefits financially, the benefits to the mother's health, and the benefits to the infant, I hope that you too can decide that breastfeeding is in fact the most nutritional and beneficial form of feeding for an infant. Many people oppose breastfeeding for several financial reasons. Some feel that breastfeeding costs just as much, if not more, than formula, because you have to buy a breast pump, which could be $200 plus, and nursing pads, lanolin, nursing clothes. I did the math, and when you purchase formula, for a small container of formula, it's $15. And I stated these facts on your sheet of paper. $15 for 1 can of formula, on average, is $190 a month for the needs of an infant. That equates to an average of $2,280 a year per child. So that's for every child that you have per year. So some infants go to 15 months. The U.S. Breastfeeding Committee states that for private and government insurers, a minimum of $3.6 billion is used to treat diseases and conditions preventable by breastfeeding. That's far more than a $200 breast pump, or $200 in nursing clothes, or a $5 container of lanolin. Note that the breast pump and the breast clothes and the lanolin are things that you do not have to have. Those are desires and things that you may choose to have. Some people oppose breastfeeding because they feel that it doesn't have enough of an effect on the mother's health to really make a difference. They don't feel like it has an effect on her psychologically, and they don't feel like it really changes her bond with her infant. They also don't feel like it really makes enough of a significant change in her weight. I've found that breastfeeding is rewarding, and it's very simple. Sometimes when you're mixing a bottle of formula, that's not as simple as being able to nurture and breastfeed your child. Breastfeeding improves the mother psychologically and emotionally. It helps build up her confidence with her infant. So when she's nursing, she gets a confidence that she is providing the correct nutrition for her child, and that her body is giving her child what it needs, and that kind of builds her up, especially after just having a baby. The National Resource Defense Council states that breastfeeding releases a hormone called oxytocin, which causes the uterus to contract and return to its normal size more quickly. That doesn't happen when you're feeding with formula. So when the uterus contracts and returns to its normal size more quickly, you lose water weight with that, and you lose weight more quickly with that. Also, when you are breastfeeding and when you're pregnant, your body reserves energy for lactating. when you're breastfeeding, your body lactates and it uses that reserved energy and it burns those calories more quickly. So it helps you to lose weight at a more significant rate than feeding with a bottle or formula. Some people oppose for the biggest reason that oppose breastfeeding, and for the biggest reason is the effects on the infant. They don't believe that it is more nutritional for the infant than breastfeeding. They also do not feel that it has a psychological effect on the infant. It has been proven that breastfeeding can prevent obesity later in life because the portion size, it helps you to portion your food better. Whereas formula, the infant just keeps drinking and drinking, they really don't know when they're full, and then the formula expands their stomach. So that causes the same issue later in life when an adult is eating and they're really not sure when to stop. The National Resource Defense Council states that many studies show that breastfeeding strengthens the immune system. The Mayo Clinic also states that commercial infant formulas don't contain the same immunity-boosting elements as breast milk do. So when your infant is born, your body produces exactly what your infant needs in carbohydrates, proteins, fats. It also contains active infection-fighting agents in white blood cells and chemicals to help fight off different illnesses and colds and diseases. And when you feed an infant with formula, formula does not have those same active ingredients to help fight off those illnesses. The National Resource Defense Council states that significant evidence suggests breastfed children develop fewer psychological, behavioral, and learning problems as do children that are breastfed. After the research I have done on the benefits financially, the benefits to the mother's health, and the benefits to the infant's health, I hope that you can understand these benefits, and I hope that you too can choose to breastfeed your child in the future, or if you already have children, maybe you can encourage somebody else to breastfeed their child. I hope that I can leave you with a message that you have the best gift that you can give your children. Thank you all for coming.